Welcome back on the program. Now, the big question there from that reactions of Nigerians saying, has electricity improved in your area? For me, well, it has improved. I stay somewhere in Agor. I don't know about you, Banke.
I think it's really real and it has improved.
All right, it has improved.
When there is rain, when there's a heavy rain, for like sometimes 2 days or one whole day, there's no light.
All right.
But without rain, good.
It has improved. Oh,
yeah.
Congratulations to Nigerians. Let's talk health now. The National Association of Resident Doctors has commenced a 5-day nationwide warning strike to press and fulfill outstanding salaries and welfare demands. The industrial action began on Friday, September 12, and is expected to continue until Tuesday, September 16. The planned strike follows deliberation during the NAT's online National Executive Council meeting, which convened on Wednesday, September 10, 2025, and extended into the early hours of Thursday. Now, resident doctors are demanding immediate payment of 2025 residency training funds, salary arrears, consolidated medical salary structure review, and other outstanding backlogs, among others. Now, joining us for this conversation is the founder, Love for Health Foundation, Dr. Yusuf Harun. Good morning. Thanks so much for joining us on the program this morning.
Thank you very much. Good morning. It's a pleasure.
We are seeing another strike in the country, 5-day warning strike. What do you make of this latest development coming from the National Association of Resident Doctors?
Thank you very much for this very important question. A few months ago, I was talking about health budget. That was when the National Assembly approved the budget, and for health, it was 5%. I said it on air, on TV here, TVC, that percentage is too low. Let us flash back to 2001, Abuja Declaration, when former President Olusegun Obasanjo was in power. African countries came together in Abuja and they agreed that 15% should be allocated to health. As at now, the only country that I can confirm has surpassed this expectation is Rwanda. Many African countries are between 4% and 7%. Nigeria did 5.5% in the last budget. So this is why we are having problem. There is a big disparity between the government's funding and the doctors' expectation. And this also leads to what we call brain drain. For 10 years, when I was abroad, first in Saudi Arabia and in the US, doctors are paid far more than what they are getting in Nigeria. You'll be surprised to know that what doctors are earning currently in Nigeria, even an illiterate from Nigeria that travels to the US to just work as a nanny, as a security guard, or a cleaner without any education, is earning more than what the doctors are earning currently in Nigeria.
But Dr. Harun, is it about priorities of funding in Nigeria?
I believe
the problem for
both
Nigeria
of them
and other African countries?
Yes, I believe both are. The doctors stated their priorities. The government also set their own conditions. Firstly, I believe it's not the priority of the government. It could be because many of them travel abroad to receive medical care. It could also be because they feel the resident doctors, as politicians, they feel, okay, resident doctors are not the ones that give them the block votes. It could also be due to the doctors who are in the Ministry of Health. So now, the government says, we have put some people in what is called the Medical Residency Training Fund. Most of the people there are in the Federal Ministry of Health. This is headed by the Minister of Health, Alipat, the Minister of State for Health, Dr. Isiaka Adikunle, and also even in Lagos State, where we are affected, because Lagos State, Oyo State, and Abuja are where the resident doctors, federal resident doctors, are on strike or threatening to strike. In Lagos, they started the warning strike yesterday, Friday. So I believe that this problem is because even the doctors representing us, my colleagues who are in the residency, some are already consultants, I believe they are not representing us properly. So you can be a very successful medical doctor, but you may be a poor administrator.
Let's check some of their demands. Payment of the 2025 medical residency training fund, salary arrears, 5-month arrears from the reverse consolidated medical salary structure.
That is a comments.
Comments. They also have the specialist allowances and the welfare issues. These are some of the agitations of these doctors. How do you now juxtapose this with the lives of Nigerians?
Since 2000.
About 12,000 of them have done two now.
Now, two wrongs don't make a right. But is it only in Nigeria that doctors, resident doctors go on strike? The answer is no. Even in developed countries, resident doctors strike. I'll give you two examples. In New York, Buffalo, resident doctors striked. In the UK, resident doctors striked in 2023 and even this year, 2025. But when they strike, they have an organized structure. They make sure that the patients don't fall victims, so that the popular saying, when two elephants fight, the grass will fight. In this case, it's not even two elephants, maybe an elephant and a badger, honey badger, or a rattle. Elephant and a rattle is fighting, because the federal government, being the might, they don't see this as a priority. And I believe it's not the fault of the president himself, but who is representing the doctors. I'll give you an example. In 2005, when I was even a medical student, 20 years ago, this same problem you ruled out were the same things that we're complaining of. CONMES, the Medical Residents Training Fund, poor salary. So the current government were not the ones in power then. But we have new doctors who are heading there. Okay, the current Minister of Health is not a medical doctor, but the Minister of State of Health is a doctor, but he didn't do residency. Now let's look at Lagos State, Professor Abayomi. He did residency and he also has a fellow from the United Kingdom. So I believe he is in a better position to advocate for the benefits and rights of resident doctors in Lagos, even if they are under the federal government, like these federal resident doctors are the ones striking. Currently, from my information, the state resident doctors are not on strike. LASUT is not on strike, but LUT is on strike. The Diaraba, you have the Yaba psychiatry, all those orthopedic, the ones that are federal are on strike. So I believe there must be a good collaboration. And also, I appeal to our senior medical doctors who are in position of authority. They are not doing well enough to represent the majority of doctors. And I'll give you a good example. Even 20 years ago, in 2005, I wouldn't mention names for sensitivity, but a governor asked the doctors who were in power then, who were in like commissioners, Ministry of Health, PAMSEC, special advisors, that, okay, we want to give these doctors housing, cars, increased salary, and the doctors who were in power or close to the government said they don't need it. You just spoil them. That was the feedback we got. And this kind of sentiment is still trickling till today. Also, if you look at the way, the attitude in which consultants and professors even treat resident doctors in front of patients, these patients lose confidence in some of these resident doctors. They talk to them like they're talking to houseboys. So the attitude of the senior doctors are the ones I usually blame, because they are the ones who are representing the majority of resident doctors in government. I'm talking about the consultants, the professors, or the doctors who are now politicians or who have been appointed into political positions. They haven't represented these resident doctors well.
So are you saying that these agitations are genuine agitations?
Absolutely.
Are they also constraining the lives of Nigerians? I just said earlier that about 12,000 of them are down-tooled yesterday. What's the way forward? Because these agitations has been on before now.
Okay, if we look at the brain drain of doctors for 20 years, you'll be surprised or be shocked that even this agitation is more. Many of these resident doctors, I wouldn't be surprised if many of them travel abroad. Maybe they are even writing this USMLE currently, or they are writing PLAB to go to UK, USMLE to go to the US, or they are even looking for how to go to Saudi Arabia or Qatar. Some of them even go to South Africa. So if we look at the care and the, okay, as a doctor, someone said something to me when I was invited to come to this show, and I told a patient who was also going to the hospital, but because of the strike, who couldn't go. And she said, I saw a doctor walking one day, and I felt pity for him. I wanted to give him a shirt. It's that bad.
What is the way forward?
The way forward is that there must be a full and sincere restructuring of the residency training system, this medical residency training funding system. I believe the president should declare a state of emergency on that field, to call the Minister of Health, call the Minister of State, call even the Commissioner of Health. All of them should work together and see how they can resolve this issue. Now, these doctors are human beings. They see that some people played ball. Even someone said it, that look at young girls and boys, or girls, these were the ones that were even given $100,000, even if it was in Naira, but equivalent, just for playing for 90 minutes. And they have spent their whole life, over 90 months, studying medicine, treating patients, saving lives, and yet they can't even pay basic bills in their homes.
But they can't give everybody $100,000.
But they can do something better than what they are doing. Look at also the senators. Their salary were increased. Each of them were given SUVs. So the doctors see this and say, okay, can't you do better for the doctors? Doctors are not in millions in Nigeria, and many of them are traveling out.
Of medical doctors outside the shores of Nigeria?
Thank you very much.
Look at the UK and the US.
I think even in Nigeria, you should also.
I'm going to compare it. I did an analysis. Average based on states and specialty. Those who are surgeons, they get more. An average medical doctor in the US gets average of $100,000 a year. That is like 156 million naira.
What about Nigeria?
In Nigeria, 230,000 naira
monthly
a month. So this is the disparity. And they see senators, House of Reps, House of Assembly members. Now we know that we have the system that is not the president that determines the salary of the House of Reps or senators. You have the RFMC, something like that, that determines it. We also have that for the doctors, the MRTF. So I am putting the blame on these same doctors who are in authority, positions of authority. They are the ones who are not representing the resident doctors. My suggestion to the president and to the federal government is that among the resident doctors, representatives should be selected from among them to represent them better. Because the federal government just says, okay, at least it is some of your people that are also representing you, and some of your people are saying that the money is okay for you. You don't need car, you don't need housing.
You said something about the Minister of Health, Mohammed Ali Party. Checking through his profile here, he is American board certified both in international medicine and infectious diseases. So he should also know better that the welfare of resident doctors is also key.
There's something called, I don't know if it is called forgetful syndrome, or when they pass through a system, they just want to kick the ladder off. I'm not specifically saying it to him, but it's a syndrome that it's happening in our society. It's so unfortunate that if he has this high resume, his priority, and he knows how doctors are being taken care of over there, they should reflect the same. Before the doctors went on strike yesterday, they gave warning strike, they sent communique, they approached the Ministry of Health, they approached the MRTF, Commerce, they talked about the commerce, and nothing was done until they strike, and many people are losing their lives. So I believe strongly that there should be a positive attitude towards health.
The government is not sleeping at the moment. I think they are doing something to ensure that this strike is called.
I believe strongly in the government of President Asiwaju Tinubu. I know in his tenure, he has avoided strike multiple times. Look at the one of Pengasin, look at the one of the oil. There was a scare that there will be scarcity of fuel on Monday, but today is Saturday, there was no scarcity. I'm very optimistic that Asiwaju, even if he doesn't say it publicly, I am very optimistic, even in France where he is, I am very optimistic, and I'm sure that he will reach out to the Minister of Health and direct him that he must resolve this strike immediately.
Love for Health Foundation, Dr. Yusuf Harun, many thanks for joining us on the program this morning.
Thank you very much.
All right,
it's always a pleasure.
I think that's why you left the public sector to the private sector.
Yes, that is it.
All right, still to come on TVC Breakfast Saturday, 14 political parties, including the All Democratic Alliance and the African Democratic Congress, get the green light from INEC to move forward to the next stage. Stay with us. We'll be right back for this conversation. Do not go anywhere.